Hi, and welcome to the new module on how to reduce the risk for suicide among your patient population. Effective July 1st, 2020, this became a national patient safety goal. So our objectives are really to identify who's at risk and identify the evidence-based processes for conducting suicide risk assessments. We're going to review 7 evidence-based behaviors to competently manage your patients at risk for suicide. And we're also going to describe how monitoring the implementation and effectiveness is important to improve compliance, safety, and patient outcomes. So who is at risk? Someone who is experiencing severe anxiety or agitation, who are depressed or psychotic, have a history of previous suicide attempts, have recently been discharged from an inpatient psychiatric unit, are experiencing intense feelings of hopelessness or abandonment, have sleep disturbances, are actively abusing alcohol or substances, are actively withdrawing from alcohol or substances, verbally expresses suicidal thoughts, have a family history of suicide, have a physical illness such as chronic pain or recent cancer symptoms, are military personnel or veterans, have sustained a recent loss, including the death of a loved one, divorce, separation, loss of a job, or finances, or someone who says goodbye with finality, like "I won't be here when you return." So who is at risk? Just about everyone you might come in contact with, especially in this current post-COVID time when people are sustaining significant losses in their lives. So be aware that almost everyone that you come into contact with may be at risk. So when is a patient most at risk? This would be change of shift, early morning hours, nighttime, weekends, holidays, after visitors leave, after phone calls, after disturbing or distressing news, shortly after admission, and near discharge. So when is a patient at risk? Almost all the time. So there are 7 evidence-based elements that have been identified where nurses can play a key role and the hospital organization can play a key role in reducing the risk of suicide among your patient population. We will go over each one of these and how you as the point of care nurse can impact the safety of at-risk patients. So environmental risks are those items in the patient's environment that could be used to harm themselves or others. You will hear the term ligature in learning about suicide risk, and a ligature is anything which can be used to attach a cord, a rope, or other material for the purpose of hanging or strangulation. Ligature risks can include handrails, doorknobs, door hinges, shower curtains, sink faucets, and handrails. Other things can be vents or exposed plumbing and pipes, soap and paper towel dispensers, power cords on the medical equipment, call light cords, light fixtures, the ceilings and the utility closet items that might be in the hallway, such as mops or cleaning agents. And then finally, the patient's personal items, such as belts, shoelaces, jewelry, and other clothing items. So the healthcare environment, including the patient rooms, the patient bathrooms, the corridors, and the common patient care areas, can contain features that patients can use to attempt suicide. Although the most common hazards for suicide risk are ligature anchor points, there are many other types of hazards. So it's important to do a thorough assessment of the environment to minimize all potential suicide risks. For most of our organizational partners, non-psychiatric units that are not required to be ligature resistant, the focus really should be on rigorous implementation of protocols to keep patients safe, especially one-to-one monitoring. Non-psychiatric units in general hospitals are not expected to be completely ligature resistant environments. Nevertheless, these facilities should assess clinical areas to identify objects that could be used for self-harm, routinely removed when possible from the area around the patient who has been identified at high risk. This information can be used for training staff even who monitor high-risk patients. For example, you can develop a checklist to help staff remember which equipment should be removed when possible. So let's take a closer look at this typical hospital room. What do you see in this picture that could pose a threat to the safety of a patient who is at risk for suicide? Did you choose window coverings? They can be used as a ligature. Often hospitals have blinds in them with cords. Did you say curtains? The privacy curtains can be used as a ligature. Medical equipment is a ligature and also can be a weapon risk. The telephone certainly is a ligature risk due to its cords and also a potential weapon. Furniture can be used as a weapon as also a ligature point. And finally, the bed has multiple ligature points for cords and linens. So be aware of your surroundings, be aware of your patient's environment, and if you do identify these risk items, work with the team to identify a checklist or something that will give you a clear and consistent way to clear that room of environmental risks. So the Joint Commission requires screening for suicidal ideation using a valid tool starting for people aged 12 and older. But these are for people who are being evaluated or treated for a behavioral health condition as their primary reason for being admitted. But it's really important for all of us to remain aware that comorbidity behavioral health conditions can be very prevalent among our patient populations. Patients being evaluated or treated for behavioral health conditions often have suicidal ideation, meaning they have had thoughts of suicide or thoughts that they wanted to kill themselves or hurt themselves. Brief screening tools are an effective way to identify individuals at risk for suicide who require further assessment and steps to protect them from attempting suicide. So screening tools should be appropriate for the population to the extent as possible. You know, we're always concerned about using age-appropriate tools. And some of the screening tools are listed here. The Columbia Suicide Severity Rating Scale can be used for both screening and more in-depth assessment of patients who screen positive for suicidal ideation. And valid tools provide an easy way to identify those patients at high risk and then mitigate those risks more efficiently and more effectively. So what if your patient who screened positive for suicidal ideation needs additional assessment? The assessment directly asks about suicidal ideation, about a plan, intent, suicidal or self-harm behaviors, what risk factors are, and what protective factors are. So patients with suicidal ideation vary widely in their risk for suicide attempt, depending on whether they have a plan, they have an intent, they have a past history of attempts. It is important to conduct an in-depth assessment of the patient who screened positive for suicide risk in order to determine how to appropriately treat them. So the use of this evidence-based assessment process or tool in conjunction with a clinical evaluation is effective in determining that overall risk. Communication among the healthcare team is paramount to successful positive patient outcomes, as we all know. As the nurse and coordinator of care, it's critical nurses document patients' overall level of risk for suicide and the plan to mitigate the risk for suicide. It's important for all clinicians who might come in contact with the patient at risk for suicide to be aware of that level of risk and the mitigation plans to reduce that risk. So this information must be explicitly documented in the patient's chart. And as you know, it is important to follow written policies and procedures addressing the care of patients identified at risk for suicide. At a minimum, these should include the following listed here: training and competence assessment of staff who care for patients at risk for suicide, which you have already learned and engaged in this module, but also guidelines for reassessment and monitoring patients who are high risk for suicide. Does this remind you of another patient population that requires specific assessments? Think about your assessment and reassessment responsibilities with patients in restraints. This is not a new behavior. We adapt to the needs of our patients and how we can best meet them. So take a minute to look at your hospital's policy and procedures and review what procedures are in place to assess, reassess, and monitor your patients at high risk for suicide. Also review your hospital's written policies and procedures for counseling and follow-up care at discharge for patients identified at risk. This is not something to take lightly. Studies have shown that a patient's risk for suicide is high after discharge from a psychiatric inpatient or emergency department setting. So developing a safety plan with the patient and providing number of crisis call centers can decrease suicidal behavior after the patient leaves the care of your organization. At the completion of this module, you will continue on to the next item, which is reviewing a simulation of the actual development of a safety plan between a healthcare provider and a patient. And finally, you cannot manage what you do not measure. Nurses make some of the most innovative quality improvements, and reducing the risk of suicide is an ideal unit-based or even hospital-wide quality improvement initiative to be taken up by nurses. Be sure to monitor the implementation and the effectiveness of your policies and procedures for specifically screening. How are you screening? How is the assessment done? And how do you manage patients at risk for suicide and take action when you see that there is non-compliance or there's problem with your data coming in? So high reliability in suicide prevention can only be achieved if there is strict adherence to policies and procedures. And monitoring that adherence is essential. In some of the suicides reported to the Joint Commission, the root cause was identified as a failure to adhere to policies, such as the big one, the period of time when one-to-one monitoring was not done for a high-risk patient. So keep all of this in mind as you move forward through the rest of this module, and please be vigilant in keeping your patients at risk for suicide safe. Thanks. Please return to the course browser window to continue with the next item.